one thing that we've heard a lot is the use of machine learning to analyze previous clinical trials and data from previous clinical trials. And there's also these conversations about insights being found across specialties and things like that. Are are you thinking at all, or is there conversation in the field about how data might be kind of set up in order to think about how it could be analyzed in the future by artificial intelligence?
Of course. When you set the expectation what you have, you can predict the future, correct? So definitely this will be a major tool.
Mm-hmm. So let's talk about the patients for a little bit, just from a patient perspective. For patients and families facing a diagnosis of leukemia, what advice would you give regarding new treatment options and things like clinical trials?
Leukemia is a rare disease. I think for anybody affected by leukemia, which is not something great, there's tools to cure leukemias, and I urge them to reach out to Center of Excellence,
Mm-hmm.
at least for second opinion, if not treatment.
Mm. Um, what does the approach look like from a multidisciplinary perspective? Do you think there needs to be more multidisciplinary approach to patients with CML, or
Well,
are there gaps?
of course, we practice with our colleagues. I gave an example in CML when we look at the toxicity of certain TKIs and mainly cardiac. I fortunate to work at a place where I can have access to my colleagues who are in cardio oncology and others. So yes, we don't practice by ourselves, and I think we're open for communication. And you mentioned the AI, like we're not anymore alone. So we are part of a whole global body, and I think we should take advantage of it.
When it comes to communicating with patients, both the state of their disease and their options, where do you see gaps in patient communication, or what are some maybe possible misconceptions that patients often have that might impact their decision making
You know,
process?
one thing of the patient is sometimes they're shy of asking questions, or they feel like, oh, I should not bother the doctor or whatever. I think when I meet a patient, I tell them, you're my boss and I work for you, and I will do everything I can to help you. So just whatever you have in mind, feel free to ask, not today, tomorrow, anytime.
What would you see or hope to see as options for patients who maybe don't have access to hospitals that are as fortified as MD Anderson?
You know, this is a major problem in this country because we're so big and people may be 8, 9, 10 hours away from our center. This is why I think we need to come up with a new strategy that can be deliverable and easily to patients wherever they are. And that's why we're working in ALL and we're developing a regimen that can be applicable anywhere, short and simple to improve the outcome.
Mm. What do you think are some of the biggest gaps to having more people participate in clinical trials? Because we always hear about clinical trials, maybe.
There's always logistical issues, distance, travel. Like if I have a trial in Houston here, I can cover the trial, the drugs, and everything else. But patients still have to drive, to travel, to live in a hotel, to rent an apartment, and these are all expensive. They're not covered by insurance or anybody else. I think we need to make the medicine more affordable to our patients. And by medicine, I mean everything that comes with it.
Sounds great. Do you have any parting words for your fellow physicians in the field that might be maybe working at hospitals that aren't as fortified or have access to?
I will tell my colleagues we are in the best time when I cure this disease. I'm available anytime. Please reach out. Happy to help any way I can.
Well, thank you so much for joining us on MD Newsline. It's been an absolute pleasure.